My name is Dr. Britt Lehmann-Bender, and today I wanted to talk to you about what makes people sick or healthy. Now, you might think it's their genes, but actually things like people's race and gender, their housing and employment, or their childhood experiences and their access to healthy food have the greatest effect on their health. We call these things the social determinants of health. And we know that income, or having enough money, is a really important part of that, because it's important not to be stressed about where your next meal is going to come from, or if you're going to be able to pay your rent on time. Now, we know that chronic stress increases people's cortisol levels, and a high cortisol level increases your inflammation, and it increases your risk of things like heart attacks, strokes, diabetes, and many types of cancer. High stress doesn't actually affect rich and poor people the same way. A CEO who works 70 hours a week will actually have a lower cortisol level because she has less stress and more control over her job. Whereas a single mom who works 2 jobs and is suffering from the chronic stress of poverty because she's worried about paying her rent or if her kids are going to be able to eat, actually has higher cortisol levels and is more likely to be more unwell. And as physicians, it's our job to help people live longer and be healthier. As the gap between rich and poor grows and more people have trouble making ends meet, it's really hard for us to address the social determinants of health. I see in my clinical practice all the time that poor people are more likely to be sicker and use more of the healthcare system, which costs more money, and are more likely to die earlier than their rich counterparts. And that's why it's important for us to address things like poverty and homelessness. We have to prevent diseases before they occur.